Today, I would like to talk about cytokines and chemokines as a possible biomarker in atopic dermatitis. Atopic dermatitis is very common skin diseases. There have been possible causes of atopic dermatitis, including non-allergic factors, and also allergic factors, including infiltration of mast cells, eosinophils, Th2 cells, and Th22, Th17 cells with elevated TARC. And other possible causes include mental stress, climate, sweat habits, and microbiomes. There are many T cell subsets in the skin, but among them, it is well known that Th2 cells, which produce IL-4, 13, 31, and Th22 and Th17 cells are known to be infiltrated into the atopic dermatitis skin lesions. And for these Th2 cells, Th22 cells, and eosinophils infiltrate into the skin, chemokine receptor is very important. And among them, Th2 chemokines such as CCL17, 22, and other chemokines attracting Th22 eosinophils include CCL 13, 26, 18, and 27. So this is a cartoon of the pathogenesis of atopic dermatitis, and it is well known that many cytokines are known to be involved in the pathogenesis of atopic dermatitis, such as IL-4, 13, 5, 31, 17, 22, 33, etc. Unfortunately, targeting these cytokines, there are many candidates biologics are under clinical trials. So we can know that cytokines, chemokines are involved in the pathogenesis of atopic dermatitis, but not all of them are known to be a good candidate of biomarkers. Only some of them can be a biomarker in atopic dermatitis. We, International Eczema Council members, did a very thorough survey to find and to address biomarkers in atopic dermatitis, and we recently published a review paper into JACI. In this review article, biomarkers can be important to improve AD diagnosis, disease severity, and predicting atopic dermatitis development, concomitant atopic dermatitis diseases, or therapeutic responses. And today I'd like to introduce some of the reports of this review article and consider the possible biomarkers, especially in terms of cytokines and chemokines. So for biomarkers for differentiating AD and psoriasis, it's well known that low NOS2, so iNOS, and elevated CCL27 CTAP is known to be important for differentiating atopic dermatitis and psoriasis. Atopic dermatitis, as I mentioned, eosinophils, mast cells, Th2, skin homing T cells are involved. So that's why eotaxin, MCP4, and TARC, MDC, CCL27 are known to be important chemokines to the development of atopic dermatitis. On the other hand, psoriasis skin lesions is known to be involved in neutrophils and Th17 cells. So the possible chemokines for the psoriasis is IL-8, GRO, and MIP1 alpha, beta, MIP3 alpha. And the second topic about biomarkers correlated with severity of atopic dermatitis. So the top of the list is CCL17 TARC. There are more than 20 publications related to severity of atopic dermatitis. And the second one is MDC, CCL22, and the third is IgE, and followed by eosinophils, ECP, IL-22, IL-13, IL-18, CCL27 CTAC, S100, E-selectin, MMP12, and LDH, and CCL18 TARC, eotaxin, and IL-19. So these biomarkers correlated with severities are mainly Th2, Th22, eosinophil, chemokine receptors. But there are other possible candidates of biomarkers in terms of cytokines, such as IL-22 and IL-18. What are they doing? For example, IL-22 is known to promote proliferation and acanthosis of keratinocyte. So hyperproliferation of keratinocyte may be induced by IL-22 in atopic dermatitis. And about IL-18, keratinocyte upon allergen exposure produce IL-18. In the presence of IL-22, IL-18 promote Th1 cell induction, but without IL-22, IL-12 stimulation, IL-18 can induce Th2 cell infiltration and induction. So the development of atopic dermatitis is related to IL-18 presence. And the third topic is biomarkers correlated with therapeutic responses. CCL17, TARC, MDC, IL-13, IL-22, MCP4, CCL26, CCL18 are good candidates, and these are overlapping with biomarkers correlated with atopic dermatitis severity. And the fourth topic is biomarkers useful for assessing treatment compliance. So we questioned to the IEC members, could blood test biomarkers be useful for assessing treatment compliance? And 77% of our members say yes. And which biomarkers would you suggest? That is CCL17 TARC, followed by IgE, eosinophils, IL-13, and other biomarkers, including CCL20-26, soluble IL-2 receptor and IL-22. And in Japan, we use CCL17 TARC as a biomarker for atopic dermatitis. We use quite regularly, routinely in atopic dermatitis clinic. And in Japan, CCL17 serum levels can be supported by government health insurance since 2008, and we can measure up to once a month, and patients pay just $6 per sample. And we can measure within 20 minutes using a new system. So patients can get the information of CCL17 TARC levels upon the clinical visit. And the beneficial points of TARC is we already know that the standard level, normal levels of TARC quite precisely. And Dr. Kataoka measured the correlation of other biomarkers with easy levels, and among them, TARC is the most closely related to the severity of atopic dermatitis. So TARC can be a very good biomarker for evaluating the severity of atopic dermatitis. And another possible good point of TARC levels for clinical setting is patients can view their own disease activity as an objective number. And that's why patients motivate to monitor the efficacy of their treatment and motivated to receive continuous therapy, so improve compliance of the clinical. But the limitation to the use of serum TARC as a biomarker include TARC is not a diagnostic marker for AD alone, because TARC is elevated in other skin conditions. And some patients with severe AD do not show high serum TARC levels, suggesting that these patients can be explained by other pathogenesis other than Th2. So this is a summary slide. So cytokines, chemokines, can be a good biomarker for AD. Biomarker for differentiating AD and psoriasis correlated with severity, therapeutic response, assessing clinical compliance, but these of them are mostly related to Th2, Th22, and eosinophils related cytokines or chemokines. So I hope these biological biomarkers in terms of cytokines and psoriasis, cytokine chemokines will improve the clinical setting of when we see the patients. Thank you very much for attention.